The views and opinions expressed on My Story Living with Lupus podcast represents each person's individual experience. By listening to this podcast or reading our blog, you agree not to use this podcast or blog as medical advice to treat any medical condition in either yourself or others. As always, consult your own physician for any medical issues that you may be having. My Story Living with Lupus podcast is officially trademarked, all rights reserved. Thank you for joining me for another episode of My Story Living with Lupus podcast. I'm your host, Susan Hendricks, and I'm so glad that you could join me on this Friday, June 4th, 2021. Look, I believe in bringing to you the good, the bad, and just the straight out truth about this condition. So, we're going to be discussing two subjects today. The first one is lung hemorrhage and lupus. And for lupus, mental health, physical activity matters. So that means that everyone has to get up off of their behind and get to moving to keep the adrenaline going and to keep your mind clear. So, you know what I want you to do all the way from the United States to the United Kingdom. That's right, I'm speaking of England, Scotland, and Wales. Get ready to grab your cup of coffee, your cup of tea, and to my listeners late at night, go ahead, get ready to grab your favorite glass of wine and join the conversation right here on My Story Living with Lupus. Also, let me put this disclaimer out. When we talk about lung hemorrhage and lupus, yes, I'm speaking of that, but which patients die. So if you are under the age of 18, please don't listen to this because it may have some information in this research that you may not be able to handle. So, discretion is advised. The Charlie E. and Minnie P. Hendricks Foundation for Chronic Illness Awareness, giving hope and empowering those who suffer with chronic illness. See one, reach one, educate one to empower the masses. You can contact the foundation at 313-303-9217 or visit their website at https://cemphfoundation.com. This is a 501c3 organization. No one should live in lack All contributions are tax deductible. Thank you for joining me today. Now, this first half of the show is about people's mental health with lupus and how physical activity matters. You probably, like the majority of us, some days you can exercise and some days you can't. Now, these past couple of weeks for myself, I have not been able to exercise because let me tell you, the fatigue is oh so real. I'm having pain on the left side, in the left side of my leg. And I'm going for tests at the hospital next week for several things. One is for the cardiologist. The second is for the pulmonologist. I've also have been having a difficulty in breathing, and they're trying to make sure that the pressure in my arterial is not high. And also, they don't know if the reason why I'm having such a hard time breathing is based on I have nodules on my voice box, and they're just trying to rule out everything. But the fatigue is real. So once I get through with this podcast, I'm going to lay down for a minute because the pain in my leg is oh so very real. But let's get to for lupus mental health matters. We all know that inactivity among patients with systemic lupus, better known as SLE, was associated with a more than threefold increased risk for development of depression among patients who describe themselves as inactive at baseline. Incident depression was diagnosed during the subsequent 2 years in 38% of SLE patients, compared with 14% of those who were active. Now, in a multivariate analysis that adjusted for sex, race, comorbidities, and disease activity and damage, the hazard ratio for incident depression among inactive SLE patients was 3.88. Now, excuse me, depression is very common among SLE patients, being diagnosed in 40 to 50% at some point during their lifetimes, compared with 17% of the general population, and can have serious impact on numerous disease-related outcomes, including quality of life and disability. And we have to remember that the quality of life perspective is dependent on each individual's perspective on what is the quality of life for that individual. Though the higher prevalence of depression and lupus relative to the general population is well demonstrated, these psychological, biological, and lifestyle factors responsible and measures that can be taken to mitigate them are not yet well defined. Now, among the factors contributing to depression in the general public is physical inactivity. Now, to examine the possible role of this factor in patients with SLE who often face barriers to exercise, including pain, fatigue, and medication adverse effects. Now, the researchers conducted annual interviews of individuals enrolled in the California Lupus Epidemiology Study during the years of 2007 to 2009. Depression was evaluated on the 8-item patient health questionnaire depression scale with scores of 10 or higher representing clinical depression. Inactivity was determined by the rapid assessment of physical activity instrument in which patients who reported that they rarely or never do any physical activities were considered inactive. Now, the analysis included 225 patients who were not considered as having depression at baseline, although a history of depression was permitted and was present in 26.1% of the cohort. Participants' mean age was 45, and almost 90% were women. The sample was diverse with 35% Asian, 30% white, 22% Hispanic, and 10% African American, and the remainder classified as unspecified or other. Now, disease duration was almost 17 years, and the mean lupus severity index was 6.9. A total of 18% of participants reported being sedentary. And these patients more often were Hispanic or African American, had poverty level incomes, and were less educated. Now, see, I always have a problem when they state um I don't want to say facts, but for the sake of this research, facts such as this: Hispanic or African American, poverty level incomes, and less educated. You have some of your most educated individuals living in urban communities who have never finished high school or college. And it really irritates me when I see data represented like this. Um, but getting back to the research, over a mean of 26 months of follow up, there were 37 new cases of depression. In an analysis, factors that were significantly associated with incident depressions were inactivity, poverty level income, disease damage, and cardiovascular disease. Now, but in the multivariate analysis, inactivity showed the strongest association, even more than poverty level income, racial, ethnic minority status, SLE disease activity, coexisting cardiovascular disease, or other comorbidities. Now, this study was the first study to confirm an elevated risk for depression among sedentary lupus patients. Given the high burden of depression experienced by lupus patients relative to the general population, even among those with low disease activity and less severe disease, this finding is an important step toward understanding the contribution of lifestyle factors to mood symptoms in a uniquely vulnerable patient group. Now, I would have liked to seen in this research a more diverse and not just Hispanic and African Americans, because you leave out two groups, the Asians and the whites, where it states, well, it doesn't state, but it would have me to think that the poverty level income does not exist in the Asian community or the white community, and that less educated does not exist in the Asian community or the white community. To me, this data, when it comes in regards to that, is skewed because poverty has no color barrier, and education at this day and time has no color barrier. You have those in the Asian community that just like the African American and the Hispanic community, you have highly intelligent people in these communities, but you focus mainly on the communities of color. Now, we know that I had to take a sip of tea. We know that in communities of color, there are less opportunities for better paying jobs, where then that person can go and get a gym membership to have a healthier lifestyle, We know that there's poor access to health care in communities of color. We know that there are food deserts in communities of color, but those communities of color spend more money across the board than any other nationality, and communities of color are at greater risk for poor health due to the fact that there are less paying jobs in these communities, and hospitals seem to stigmatize people of color. Basically, you don't have time to get out in the community themselves to reach that person to talk about staying active. But we are still stigmatized when it comes to data. That's just my opinion. When we return, I'll talk about lung hemorrhage and lupus, which patients die. Discretion is advised. So if you're under the age of 18, go ahead. Don't listen, because it may be some things in the next segment that you won't be able to handle. So stick with me. If you would like to appear on an episode of My Story Living with Lupus, you can contact us at mystorylivingwithlupus@gmail.com. Also visit us on our Instagram page and also our website, My Story Living with Lupus. Thank you for joining me back. Now we're getting ready to discuss lung hemorrhage and lupus and which patients die. Now, discretion is advised. So if you are under the age of 18, go on, skedaddle doodle on out the room, turn your iPad off, your headset, and everything else. Because it may be some information that you are not equipped to hear if you're under the age of 18. I'm sorry, I'm getting ready to say 13. Now, the risk factors include older age, longer disease duration, infection, and certain treatments. Risk factors for mortality in patients with systemic lupus who develop diffuse alveolar hemorrhage, better known as DAH, included older age, longer disease duration. They did a meta-analysis on this where significant correlations were seen for older age at the time of the diagnosis of DAH. Duration of SLE also showed a significant correlation. Now, DAH is a rare but potentially lethal complication of SLE, with mortality rates up to 85.7% having been reported. Now, it is believed to result from pulmonary capillaritis and can develop in up to 6% of the patients hospitalized with SLE. Now, the condition is associated with hemoptysis, shortness of breath, hypoxemia, and sharp declines in hemoglobin levels, with imaging findings of diffused ground glass. Previous studies have also sought to identify factors that are associated with mortality, but have had conflicting results. For example, contradictory findings have been reported for the influence of disease activity, the presence of lupus nephritis, and the effects of cyclophosphamide treatment. Now, in an attempt to clarify these prognostic concerns, Zhao and colleagues conducted a systematic review and meta-analysis that included 8 cohorts and case control studies, all of which were retrospective in design. A total of 251 patients with 262 episodes of DAH were included. The 8 studies ranged in number of patients from 8 to 94 and had mortality rates ranging from 29.2 to 61.9%. The methodology, quality of the studies was relatively high, although some heterogeneity was observed. Factors other than age and disease duration that were associated with mortality were infection, mechanical ventilation. Factors that were not found to be predictive of mortality included sex, the presence of lupus nephritis, declines in hemoglobin, levels of complement, SLE disease activity score, and treatment with cyclophosphamide or intravenous immunoglobulins. With regard to the lack of mortality association seen with lupus nephritis, which has traditionally been viewed as a poor prognostic factor in SLE, the authors suggested that DAH itself can lead to high mortality, far exceeding what lupus nephritis can contribute. Thus, the add-on of lupus nephritis makes no difference. The small number of cases may have introduced bias to the analysis. More studies and a larger sample size concerning this issue may help to identify the role of lupus nephritis in the outcome of SLE and DAH. They also emphasize the importance of concurrent infection, which is the most common cause of death among patients with SLE and can relate to both the disease itself and the powerful immunosuppressive drugs used to treat it. Blood filled in the spaces in a patient with DAH is a favorable medium for bacterial growth, which increases the risk of infection. The presence of infection also complicates the treatment. And throughout the course of DAH, preventive measures and rapid detection are of a great importance. When we return, we'll finish up with lung hemorrhage and lupus. So stay with me. Ophthalmology Associates, PC, Doctors Berman and Dr. Zuckerbrod, treating diseases of the eye and eye surgery. You can reach them at 313-3450. And I am back, and we're going to finish up talking about lung hemorrhage and lupus. Lastly, in this research, cyclophosphamide, which is commonly used in severe SLE and in up to half of patients with DAH. In one earlier study, the use of this immunosuppressant was associated with worse outcomes with mortality rate of 70%. But a more recent study showed beneficial effects and an increased likelihood of survival after adjusting for factors such as disease activity and mechanical ventilation. Advances in the care of critically ill patients may have contributed to the differences observed in these studies. The factors associated with SLE DAH mortality identified in this analysis: older age, longer disease duration, infection, and the use of mechanical ventilation should be given increased attention in prognostic and treatment decisions. A limitation of the analysis was the retrospective design of the included study. When I return, I want to talk to you about, well, I can do it now. Let's do it now. You know, Most doctors won't tell you everything in regards to this illness. Maybe it is based on, well, I put it this way, they're handling their patients the best way they can. They know the emotional side of their patients. That's some doctors. Some doctors just don't care. They'll write you a script just to get you out of the office. But I'm talking about the doctors who do care. Now, as for myself, and I don't expect everyone to be like me, I told my doctors, just come on, give me the real. Don't sugarcoat anything because I can see through the sugarcoat and the BS. Just tell me straight up, you know, what is what and what is going on. But I say all of that to say, be your own best advocate. And I'll say that again. Be your own best advocate. Because if you don't, who's going to do it for you? Don't depend on other people to ask the doctors questions regarding what's going on with your health. Because in reality, just like my sisters and my brother, they know I have lupus. They've researched some things about lupus in regards to me. And they tell you, don't tell me no more. I can't deal with it. You know, and as my brother once told me, he said, I know we all have to leave the face of this earth one day. He said, but I, as someone who deals in holistic medicine, and I told them that you had lupus, and all they could say was, wow, she's battling a serious and deadly disease. I said, yeah, I knew that. You didn't know that? And my brother further stated, he said, not by the way you act. And I asked him, I said, well, how do you want me to act? I'm not going to have a pity party. I said, it's days that I can do certain things, and there's days that I can't. And I told him that I wouldn't want anybody else living with this illness to stop living their life, to stop doing what you love to do. Get up and enjoy yourself, live your life to the fullest. Because I tell you this, when I leave this space on this earth, I'm going to go on empty and will be in a pair of stilettos and my all white suit going up to the gates and banging on it and saying, Mama, Daddy, come let me in. So live your life to the fullest. Lupus is no longer a death sentence. It's what you have in your mind. How you think in your mind is how you will live with this illness. If you think you can never make it, you'll never make it. But if you have the fighting spirit within you, you'll be just fine. So continue to fight. Be your own best advocate. Stay with me, and I'll be right back. Well, it's that time for me to go. I really have to go and elevate my leg. The pain in it is oh so very real, and I don't take pain medications. And more than likely, like I said before, I'll find out what's what when I go to the hospital next week for testing. Hey, I would love for you to follow me on Instagram at My Story Living with Lupus. Also on Facebook, My Story Living with Lupus podcast. So just put in My Story Living with Lupus. Also Twitter, the same. And if you're listening on Stitcher, Spotify, I appreciate you. But if you're listening on Apple Podcasts, do me a favor. Please go over and rate us, follow us, and leave a comment, because your comments help to make what I do better. Before I go, I want to leave you with this one more other thing. Next Sunday, June the 13th, the foundation that I formed, Charlie E. and Minnie P. Hendricks Foundation, will be feeding, clothing, providing personal care items to those that are in need. You can go on over, and I believe there's some pictures posted on the foundation's website at https://cemphfoundation.com. Also, you'll notice that starting in July, from July 1st to July the 20th, the foundation will be assisting 2 individuals to purchase their medication. $50 towards your medication will be paid directly to your pharmacy. So we will be assisting those with lupus in purchasing your medication. So go on over there. Don't forget to follow us. And like I stated before, if you are on Apple, listening on Apple, please go ahead. And you know I don't ask you for much. I ask very little. To go over, to subscribe to the channel, to rate the channel, and to leave your comment. We look at every comment, and it helps us tweak what I am doing. I want to leave you with this, that first they ignore you, then they ridicule you, then they fight you, and then you win. Victory is always possible for the person who refuses to stop fighting. I'm your host, Susan Hendricks for my story, Living with Lupus podcast. Have a most safe, peaceful, and oh so blessed weekend. And live your life to the fullest. I'll see you next week for another episode.